Hey guys, it's Elliot here, and I'm getting top surgery in 3 days. On Monday, December 10th, I'm getting top surgery, and I kind of wanted to vlog because there isn't a lot of information about my surgeon online, like not a lot of videos or results or anything, and I think he's a really great surgeon. Um, and from the results I've seen, they've been really great. So I wanted to document to give people, if they want to watch, I guess, more of an idea, because I know that I've watched like 8 million videos in the past day, especially, and I only found like one video from my surgeon, but it was really helpful. So I am going to Dr. Tobias in Boston, Massachusetts, getting double incision with nipple grafts. Oh, also, just to give some background, I called for a consult in August of 2018. Their first available consult appointment wasn't until Halloween, so October 31st. So it was a pretty long gap between when I called and when I got a consult. I don't really know for other people what the wait time is, but yeah, so it was like a few months in between my first call and the consult. So my consult was October 31st, and then I got my date December 10th, um, which was earlier than they thought. They told me January. So it was, my first call was in August, and they expected my surgery to be in January. So, like, about 5 month process, I guess, is normal for Dr. Tobias. I'm really excited and I'm really nervous, but it also feels like it's not really happening. And I feel like it won't feel real until I actually like get it. Like, it's just I've been waiting for so long, and for it to finally be happening, it just doesn't, if it's just surreal. And like, I mean, right now my reality is still like I have titties, and like I have to wear a binder every day still. So it's like none of that has changed. So it's really like hard to be like, oh, well, next week I'm just not gonna do that anymore. Like, it just doesn't, I don't know. I can't wrap my mind around it. It's just really surreal. And obviously, I'm like really excited. And I think I'm most nervous because I don't know what to expect. I've never gotten surgery. And everybody's recovery and like experience after top surgery is so different. And I just like have no idea what to expect. And I'm like nervous, not necessarily about the pain, but like just because I have no idea what I'm going into, or like what discomfort I'm gonna be in, or like I just have no clue. And like, you can learn all you can from people's videos, but like everyone's so different that like you can never know until it happens. And I don't do well with that. I really need certainty, and like I hate ambiguity and like not knowing. But the only way to know in this case is to just do it. So I don't know. It's just a lot, and it still doesn't feel real. So I keep getting like distracted, and like I'm like thinking about it a lot, but at the same time I'm not. Like, I don't know. It's just so weird. I hate needles and stuff, so I'm scared of that. And I'm most scared of being nauseous and throwing up, because that's my worst fear, and I get really bad anxiety about it, more than any pain. Like, I'd rather be in pain than throw up. So I don't know. So I guess that's it for now. I'll check in again the night before surgery. And I'll see you guys then. Hey, so I'm back again. It's the night before my surgery, and I just took my shower, where you have to wash with this like special soap, um, like your whole body, and like especially the area you're getting surgery. I think it like kills bacteria, or like it's antiseptic soap. I don't know. I will check in tomorrow and before surgery. So it's the morning of surgery, and I just took my second shower with the gross stuff, and I'm really nervous, and my tummy hurts. And we're leaving in like 15 minutes to go to the hospital, and then my surgery's at 12, so I feel like they'll just take me right to like prep. I don't really know like what they do, but I'm assuming it will go really quickly because that's only like an hour until my surgery is, so that's exciting. I'm just really nervous, and yeah, I don't have anything to say besides that, so I guess I'll just be done for now, but yeah.
They're gone. Oh my god.
They're gone. Look at you.
Somebody's coming, so. Oh, sorry. Someone's coming back.
Hello.
We've waited a long time.
It looks so good.
It does.
Okay, I'm back, and I am now post-op, 1 day post-op. Excuse my appearance right now, because this lighting is ass, and I look gross. But these are my results. I think it looks really good, and the nips are like perfect placement, and the scars are really thin. So my doctor doesn't use compression vest after surgery or bandages. They just put this like surgical glue over the incisions, and then I have drains too. And then I don't have to use a compression vest until after I get the drains out, which will be like next Tuesday, a week after surgery. Pain wise, not too bad with pain. It's mostly just really uncomfortable, especially the drain on my left side is like curved underneath. So it's like almost touching my ribs, and it's really uncomfortable. But other than that, I've just been taking Tylenol and a narcotic for like on repeat, just so it's always in my system. And that helps a lot with the discomfort too, not just the pain. So that's really good. But the actual hospital stuff was totally fine. Like, that was what I was most nervous about. But I got there, and they basically like took me right up for like prep or whatever, and I did the IV fine, which I was nervous about, and I got a bunch of anti-nausea medications in the IV, and I have a patch behind my ear that you can wear for 3 days, and that prevents nausea too. So I didn't throw up, and I haven't, and I don't think I'm gonna. Yeah, everything's going well. I had like one little blood droplet like fall from my nip, and I kind of freaked out about it, but everyone around me is like, oh, it's like not a big deal. And I called the nurse at my doctor's office, so just to confirm, because I'm a worrier. Hey y'all, so I'm 3 days post-op now, and things are going really well. My problem nipple stopped bleeding, so I'm really happy about that, because I was getting really nervous that it was gonna lose it or something. But it stopped bleeding and scabbed over, and the doctor said that it's normal to have some bleeding, like little drips, so that was fine. So I've just been watching shows and taking it easy and trying not to move as much as possible. The drains are the worst part of the whole recovery. They really hurt and are irritating. But yeah, here's my chest. 3 days post-op. This was the problem nipple. You can see that it's scabbed and there was blood, but it's fine now. On this side. And it's healing incredibly well. And the scars are thin, and I'm super happy with the results. Dr. Tobias is amazing. I'm currently 9 days post-op, which means I'm 1 day from showering, as you can probably tell from my overall appearance. But yeah, so yesterday I got my drains out, and it was totally fine. Like, I was so nervous about getting the drains out, and like people had talked it up as like the worst pain ever, and it felt so weird, so I was like super nervous. But I didn't feel anything, like literally didn't feel anything. She was like, okay, breathe in, and she fucking must have just yanked it out as fast as possible because I didn't feel anything at all, which was great because I was super nervous. And I feel so much more comfortable. The drains really are the worst part of the recovery, in my opinion. My incisions have not hurt. My nips like sometimes hurt for like 2 seconds and then it stops. But the drains were just so uncomfortable and it felt like I couldn't do anything. And since they've been out, I'm so much more mobile. I feel normal, like except for the fact that I have to wear a binder. And then you get a binder to wear with over nipple dressings for 2 weeks, normally 2 weeks. But right now, 2 weeks after my appointment yesterday is New Year's Day. So he didn't have any appointments for then, so I had to wait 3 weeks. So I'm gonna have to be wearing the binder for 3 weeks. I probably could stop wearing it after 2 weeks, but I'm a little paranoid and want everything to be perfect, so I'm probably just gonna keep wearing it for that extra week until I get the okay from him to stop wearing the binder. So this is what it's looking like 9 days post-op. This is from the tape that was just on for the gauze, but yeah, this is what it's looking like. The nips are scary gross. Like, what is that? But I think it looks pretty good. So this is what the binder looks like. I just did my dressing change, so this is what it looks like. It's a little bulgy right here because I still have the gauze from the drain sites taped, which honestly is really uncomfortable, so I might take that off today. But that's why it looks really bulky, and yeah, honestly, it's not the worst discomfort because it's not really like binding like a binder because there's nothing there. It's more to just hold the dressings in place and to protect the nips. This is gonna be, I think, my last update for this video. Then I'll just do like monthly chest updates, but this is my chest 12 days post-op. I still can't get the glue, this is surgical glue, off. And I'm not gonna pull it off because I read that you can rip stitches out. So I'm gonna just let it kind of do its thing. But you can see that the glue is fine and the marker is finally coming off around my nip. So you can actually see like the nip color now, which is cool because before it just mostly looked like this, like black, and you couldn't tell what it looked like. So yeah, you can kind of see the scars underneath the glue, but I'm definitely anxious to see them like without the marker and stuff. But this is what I'm looking like 12 days post-op. You're only supposed to wear it for 2 weeks, but I had to wait for 3, so whatever. But I thought I'd just show how I'm supposed to take care of my nips like in this time when I'm wearing the binder. So I'm gonna do that, and then I think this video is gonna be over. So bye, I guess. So first I have this stuff, which are gauze strips. They're basically like little cloth things with like ointment built in. It looks like this. It's kind of what the bolsters are made out of from right after surgery, and you basically cut a little square of this to go right over the nip. So you cut 2 squares, like one for each nip obviously, and then you put gauze over that, and then you put the binder on. Okay, so this is what they look like. They're like little cloth things that are like kind of gross and feel like ointment-y, but they actually feel really nice on my nips. Like they protect it and like keep them like moist, I guess. I don't really know, but that's what they look like. Then I put the gauze over it, like a square, and then the binder, and then good to go.